our main focus in global health, and see how each of the implementation means ties up with SDG 9, which has to do with innovation and technology. The first thing to look at is WHO says one of the primary basic ways of addressing SDG 3 is to expand and strengthen the implementation of the Framework Convention on Tobacco Control. Does it make sense? Ladies and gentlemen, does it make sense? Yes, it does. Because, let's go back. Tobacco is central to most of this. And therefore, if we want to make progress, we must pay attention to that process. And it's unfortunate. I started off as a Nigerian. I was born there, raised, studied in different countries, etc. I'm now American, so I'm free to talk. America is not one of the countries that has signed onto the Framework Convention on Tobacco Control. There are about 100, yes, I'll finish soon. There are about 121 or so countries, or 41 countries that have already signed, but the US is not one of them. We need to do what we can to make sure that we join that process. As you mentioned, access, financing, health workforce. So if you are thinking of an innovative technological approach or device, what are some of the criteria that we should be keeping in mind to make sure that they really respond? One is they must be simple, easy to use, accessible to all, not just in the urban areas, but also in other places. Cross-cutting, so that one device or one diagnostic can be used for various purposes. Use existing resources. Resources, the sun, solar panels, task shifting. Lower level health workers, mid-level health workers are there. Let's use them. Internet connectivity, the cloud, and of course, cross-sector collaboration. And these technological innovations can be devices, diagnostics, medicines, therapeutics, systems and services, vaccines. And the next few slides are just to show you examples of some of them and to see how people have actually analyzed them and what good they can do. When you look at this device, it's uterine balloon. It's used for the treatment of postpartum hemorrhage. A lower level health worker at the primary health care level who is allowed to take delivery can be taught to introduce this when women do not respond to oxytocin, for example, and it saves lives. And it says that if we were to expand its use beyond the testing phase that it is now, between now and 2030, we could save as many as 169,000 maternal lives. When you think about 261,000 women dying every year, if this device would save 169,000, we've cut it into more than half. Let's look at another one. Because we're in the US, I'm sure we're used to this. When you go for your checkup, they clip it on your finger. if we made this available widely in developing countries for use in children, it detects hypoxia. Hypoxic pneumonia is one of the commonest causes of death in children. We can reduce that 6 million significantly. It says we could save almost 750,000 children. Let's look at another one. Simple water treatment to prevent diarrhea. This is very interesting. See that? If made widely available, will save 1.5 million child deaths. And not at a cost of, but we will be having a cost savings of 1.2 billion. Injectable contraceptives, they've been around for a long time. But the innovation is that BD and Pfizer are working on a long-acting, lower-dose formulation that uses Uniject and can be delivered by lower-level community health workers at home. I owe this slide to my friend and colleague, Dr. Kathleen Schmeller of MD Anderson, and kudos to Rice University. Yes, I'll be done. This is something that was innovated here, and I just want to show you how they have gone from this big one, expensive, to this stage, and to this. And if this was advanced, we could even have it cheaper because volume will reduce cost. Diagnostics for malaria. You see the reduction in malaria deaths as well as the number of cases. If we were to be able to have rapid assessment of malaria introduced on a wide scale, we could further reduce malaria deaths. And when you talk of multi-purpose, this tool here, I have no interest in, no investment in it, but I'm just pointing it out, gene extract. It can be used to diagnose TB. It can also be used to diagnose HPV infection. These are innovative diagnostics that are around, and we could expand their use. Medicines and therapeutics, simple chlorhexidine inhibiting in gel or liquid applied to the cord very early, as soon as the baby is born. I want to draw your attention to it that it can save 1 million newborns at just $81 million. That is a best buy. Single dose anti-malaria medication that is also effective against artemisinin-resistant malaria is in the works. This lady is one of my heroes. She's a nurse in Zambia, Susan. She was taught how to do visual inspection with acetic acid and cryotherapy to treat precancerous lesions. She mastered it so well, she became a trainer. And before we knew it, she also knew how to do loop electrosurgical excision procedure. Now she not only trains nurses, she trains doctors. We have a lot of Susans in different countries. They just need to be identified, given the responsibility so that doctors can do more complicated work. M-Health, the cloud, mobile phones. Let's use them. Vaccines. HPV, hitherto restricted to children 9 to 13 years. Research now suggests that it's effective even in the older women.
Sorry, I'm not sure.
And therefore we can expand the use to these ones. And malaria vaccine. Having said all this, what is the message that we're trying to pass across? I'm calling all of us to look at global health differently and to hold ourselves responsible, no matter where we find ourselves, for not more of the same in 2015 to 2030, but do something different. We need a paradigm shift in policy and in investment. Investment must favor technology, must favor innovation, so that we can reach more people and do more. Secondly, to those of you in industry, those who are in research and development, we need to identify and advance those technological innovations that deliver the best health to the most people. After all, that's what universal health coverage is all about. And you get a high return on investment. Coordination. I'm sure Patricia has heard this all her lifetime. Many of you sitting in the room have heard it. But we cannot do without coordinated cross-sector collaboration and integration. It expands our base, not only for knowledge, but for networking as well as investment. The silos must be broken. Right from policy to implementation, reporting, and replanning. And therefore, in conclusion, ladies and gentlemen, I want to submit to you that by accelerating innovations in this sustainable development era, and those innovations include examples that we have seen today and others, there are many in the field. And some of you are students who are working on such innovations. Think big. Let us make sure that we accelerate those things so that we can empower and transform global health. That's what this conference is all about, empower global health. And that would help us to open new doors of opportunities, some of which you didn't have, I didn't have, to the new generations. So thank you for your attention, and it's my pleasure to